So it said to ourselves, maybe a good idea to really see how do these patients fare when you apply a local therapy versus a systemic therapy. And we find something very intriguing where the patients who are given only a embolization, even though in the setting of advanced metastatic hepatocellular carcinoma, that probably was given with the argument that the disease or the bad disease is in the liver, this is what's going to hurt the patient, that's why we should focus on it. They fared worse than the historical control of sorafenib. Actually, their median survival is measured somewhere around like between 6 and 7 months compared to the 10.7 months we know about sorafenib. On the other hand, it brought up an interesting finding as well, which I think even is more valuable, because the first one is kind of, nobody will argue about it, even though some people might argue about the concept. But the more important one is that when you combine the embolization plus systemic therapy, the median survival goes way up and it bypasses 1 year. And that's really the question that should just be posed in a clinical trial where we evaluate patients with metastatic disease, but we still see value for them getting a embolization plus the systemic therapy on board. Again, I would give the same caution over here. This is a very small study, retrospective in nature, only one center, but if anything, just give a little bit of that challenging questions that obviously all of us need to ask so we can see where this field will go.